Hi everyone, my name is Mariam and I'm one of the dentists at Dental Care Partnership, and I'm going to be talking to you about wisdom tooth pain. So how to identify it, how to treat it, and hopefully how to prevent flare-ups in the future. So it's important to note that not everyone will necessarily suffer with their wisdom teeth, and for some of us, our wisdom teeth may never even come through. And I think the reason why most of us have problems with their wisdom teeth is because of access. So it's found all the way at the back of the mouth. It's a difficult area to keep clean. And it's normally the flap of gum around the erupting wisdom tooth, which traps food and bacteria. And that's what goes on to becoming infected or inflamed. So what are the signs of wisdom tooth pain? So it could be pain in the jaw. It could be pain around the back tooth. You could get bleeding, swelling, a bad taste or smell coming from the area as well, a sudden throbbing ache, or pain that radiates into your ear. And in some cases, facial swelling, which can radiate to the neck, and that could indicate lymph node involvement. It's also really important to note that if the swelling spreads to underneath your tongue and affects your breathing or swallowing, that you go to A&E immediately. So how do we treat wisdom tooth pain? So wisdom tooth pain can be managed and prevented with good oral hygiene. I always recommend an electric toothbrush to my patients because it's got a small round head, so it's going to be a lot easier to maneuver around those hard to reach areas, but also the fact that it vibrates and pulsates, so it's going to mean that it will be more effective at keeping that flap of gum free of bacteria and food. Also, a good antibacterial mouthwash is key. I normally recommend Corsadil, 0.2%. And I tell my patients to dip the brush or the interdental brush in the Corsadil and then use that to clean around the wisdom tooth. That way the delivery is more localized. Painkillers also, so Nurofen and paracetamol following the packet instructions. A soft diet is also a good idea, especially if you're having pain on chewing. So avoid that side completely, but just sticking to a soft diet until the symptoms subside. Another thing that could be useful is warm water and salt mouth rinses about 2 to 3 times a day. That's especially good if you've got swelling in the area because it does encourage drainage. So if the pain is quite severe or you get spreading facial swelling, then it's really important that you contact us. It might just mean that you need a course of antibiotics just to control the swelling and prevent spreading infection until hopefully you get to see your dentist, where we will properly assess and examine the area and discuss treatment options. That's all for today. I hope you found that useful, and hopefully when this is all over, you can continue going to see your dentist as normal. But in the meantime, stay home and stay safe. Thank you.